Hello and good morning. My name is Justin Mooneyhan and I work at AmSurge, an Envision Healthcare solution. As a nationally recognized leader in the management of surgery centers that deliver high quality, high value, same-day services with a superior patient experience, AmSurge recognizes the critical role that health IT professionals play in providing optimal outcomes for patients. AmSurge believes that technology, data analytics, and patient engagement go hand in hand in creating optimal outcomes for patients. AmSurge is proud to be a sponsor of Summit 20 and of the Tennessee chapter of HIMSS. We are honored to introduce this year's opening keynote speakers, former U.S. Senate Majority Leader, surgeon, businessman, philanthropist, and humanitarian, Senator Bill Frist, and Lisa Clark, Executive Director of the Destination Medical Center Economic Development Agency and a nationally recognized leader in strategic planning, research, and development. Thank you, and we hope you enjoy the session.
I'm excited to be a part of the Tennessee HIMSS Annual Summit. I'm joined today by Lisa Clark, who is the Executive Director of the Destination Medical Center Economic Development Agency. Lisa previously spent 20 years with Mayo Clinic, where she served as Division Chair in Mayo Clinic's Department of Public Affairs. She has been routinely recognized as one of the most effective and successful women in business in Minnesota. The Destination Medical Center, the DMC, that she leads today is creating, and I quote, America's City for Health in Rochester. Okay, let me start it over. Ready? 3, 2, 1. I'm excited to be a part of the Tennessee HIMSS Annual Summit. I'm joined today by Lisa Clark, who is the Executive Director of the Destination Medical Center Economic Development Agency. Lisa previously spent 20 years with Mayo Clinic, where she served as Division Chair in Mayo Clinic's Department of Public Affairs. She has been routinely recognized as one of the most effective and successful women in business in Minnesota. The DMC, the Destination Medical Center, that she leads today, is creating, and I quote, America's City for Health in Rochester, Minnesota. In our conversation today, we will explore the importance of fostering a healthy community setting to spur health system innovation. Lisa, welcome, and let's jump right in. The Destination Medical Center has been called a $5.6 billion 20-year plan to transform an American city. Explain a little bit about where this idea came from and exactly what is the Destination Medical Center.
Thank you, Senator Frist. Happy to talk about DMC, for short, DMC. Rochester, Minnesota, not Rochester, New York, and people do get the two cities mixed up. Rochester, Minnesota is a small community. It's 110,000 people. And right in the middle of this community, right downtown, is Mayo Clinic, this amazing healthcare organization, world-renowned, and it's really a very large part of this community, as you can imagine. And so what happens when we brought DMC forward is Mayo Clinic was trying to do what every other healthcare organization is doing, make sure that they're staying as a prominent position in healthcare in the world. But to do that, so many things have to change. Virtual care, reimbursement rates are crazy. There's just so many things happening in the healthcare space. And we were in a board meeting in 2010, and that's how this came forward. We said, we want to make sure that Mayo Clinic stays at the top of its game, and it will, and it'll keep the patients in the center. And at the same time, we better make sure that the community experience, the experience that the patients have 70% of their time when they're in Rochester, they are in the community, and 30% of their time, they're at Mayo Clinic. And we've never taken a look at that in a deliberate way. We've never said, if 70% of the experience for our patients that are visiting Rochester are out in the community, have we ever worked together to create this experience for patients like none other that they would experience anywhere else? So we embarked on what we called at the time, I think, community health or something, but it turned into Destination Medical Center. And true to our nature, we did about 2 years of research to make sure that we understood where the gaps were in that experience. When the patient comes here and the visitor and the traveler, and we also did it for people that live and work in Rochester, we did this research to understand what was happening in this community and was the brand of the community lifted up to match that of Mayo Clinic. And we found that the answer was there's a lot of gaps. We had a lot of gaps to fill in so many different areas. And throughout this entire project or process, I would say, is we learned that the tax base in Rochester could not support the kind of growth that we wanted to have in Mayo Clinic. So it all came together, thinking we were just going to start to work together in a better way. And we learned that this is a much bigger initiative and we needed the state's involvement. And that's how we were born.
And you give us a little sense of time and place. Rochester at that time, is this 5-7 years ago? When did that idea first come? And then how many people live in Rochester, in the immediate area and in the surrounding area now?
So there's about 110,000 in the area, Rochester City. But I think that I don't have the number in front of me in terms of the full region, but it's so critical for us to really encompass this as a regional effort, DMC as a regional effort, and frankly, a state effort. Because when we went to the state, Senator Frist, it was very clear that the state of Minnesota, the St. Paul's only about 90 miles from Rochester, Minnesota. But one of the beautiful benefits of doing this was that we got to help the legislators understand what Rochester really was on the map of Minnesota and what Mayo Clinic contributed to the state of Minnesota. I mean, people come here from all over the world and they come with hope in their heart, or they come with, I sure hope they've got this cure for me, or they come with, it's my last chance. This is my last resort. And so it is a gem for the state of Minnesota, not only financially. I mean, Mayo Clinic really contributes to the economy to the tune of about $12 billion a year. I mean, it's an amazing gem for Minnesota that they wanted to keep in Minnesota. Rochester has expanded all over the country, in Florida and Arizona, and that's really important for us. But Rochester, Minnesota is our home for Mayo, and that's where we wanted to grow to the tune of about $3 billion over the next 20 years.
I know over my years in practicing medicine in Boston initially, and then out in California at Stanford, and then for 10 years back here in Nashville, I have frequently referred, and since then, I frequently referred people to the Mayo Clinic in Rochester in particular.
Mm-hmm.
You mentioned the figure 70% of people in the surrounding area. The other 30%, where do these individuals come from? I referred from Tennessee, but I know people all over the world are referring to the Mayo Clinic in Rochester.
Yeah, most of our patient base is actually a regional within 150 miles, which people are surprised at when they hear that. So people are driving here, even during this COVID pandemic right now, people are driving for their healthcare, driving to Rochester. About 10% or less are international patients. And so, we have a draw from all over, as I said, all over the country. And we feel very blessed, particularly right now, that we have such a regional draw for our patient base.
We don't have time to spend today, but for our viewers and our listeners, I really do encourage them to look at the documentary that Ken Burns did on the history of the Mayo Clinic. Ken Burns, in only the great style of Ken Burns, tells the very inspiring, the very emotional story of the Mayo Clinic. And again, we don't have time for that today, but it's a great reference for people who hear about the mystique around the Mayo Clinic, where it comes from, the nursing, the physician, the health provider leadership it's provided. The partnership, one of the unique things about this endeavor is the public-private partnership. And we all know how important today, the public sector is not going to have most of the answers. The private sector, for all sorts of reasons, is not going to have all the answers. And that the most effective initiatives are going to come from a public-private partnership. When we say that, because it is characteristic of the initiative there, what do we mean? And how hard was it to get the public sector involved as well as the private sector?
Yeah, the public-private partnership is pretty amazing in this initiative. And basically what we're looking at is Mayo Clinic, the state of Minnesota, Olmsted County, and the city of Rochester. Those are the 4 stakeholder partners in this initiative. And when you try to bring those entities together, it really does become quite an initiative. It can test your resilience, and it can test your passion, and it can test your endurance. You know, everything that's in your body, I think it can test. And we needed to really sort of march through the state of Minnesota, because when you really think about bringing those groups together and helping people understand what DMC means to you, we had to go to places like Duluth and say, here's why you want Mayo Clinic in Minnesota, and here's why you want to support DMC, and to smaller communities around Rochester. And people really needed to understand, in order to support this, they really needed to understand what DMC meant to him or her personally, and to his or her company, and to the state of Minnesota. So we sort of addressed it, Senator Frist, as a campaign in a sense. We did the air cover, so we did a lot of work on educating people on what Destination Medical Center really means. And then we were very surgical, to use a medical term, where we were, one minute we were in front of a Lions clubs in some community, and the next minute we were in front of a union group, and the next minute we were in front of the state of Minnesota legislators. And so it was very, very deliberate in terms of bringing people together to help them understand what this meant. And when we went to the state of Minnesota, we asked for $585 million over 20 years to support $5 to $6 billion of investment in Rochester, Minnesota. And the thing that I think was one of our winning factors, if you will, you know, you sort of have to have some little nugget that captures people's attention at the state. And we brought in a model that I have been talking about across the nation, because it's something I think people should pay attention to and really think about. And you know this, usually when people are asking for money, like if a stadium or something is coming forward, they'll say, give us the money, state of Minnesota, and we'll build this thing. And I know a whole bunch of people are going to come. And we decided to just tip it on its head. We decided to say, state of Minnesota, we don't want a nickel to drop from you until we show you that we have $200 million invested in the ground first. And then the system started to work and the formula started to flow. So in 2016, we went through legislation in one session, and we did capture this $585 million nod from the state. So we're very proud of that. And then we brought our $200 million to the table in 2016. And from then on, the formula is working. So the model actually works.
And you
Less
are,
risk to the state.
the timeline again, just remind me, the planning went on for a couple of years, and the start point of the 20-year plan and build out is 2015.
Well, yeah, we got through legislation in 2013, and then we had to build our governance structure. So, you know, when you bring money forward like that, everybody needs to know who's the boss of the money and how does the money flow and how many touch points are there. And we built 2 boards. We built a for-profit board where the governor has 4 representatives, the state has 4, the county has 1, the city has 2, and Mayo Clinic has 1. So all stakeholders have representation on that board. And then we built a private not-for-profit. And the private not-for-profit board is actually the board that does the work, if you will. So it's kind of the staff reports to that private board so that we can get some work done behind the scenes with developers and investors and potential benefactors. So it was really a model that has a lot of checks and balances to it, as you can imagine, with 2 boards, but it actually works.
So your statement that one person comes from the Mayo Clinic, I just wanted to drive it home, clarify, but drive it home. The idea was born out of the Mayo Clinic, but it is not owned by the Mayo Clinic. It's not run by the Mayo Clinic. There's only one person from the board, or one person on the board from the Mayo Clinic. So describe just a little bit more about that relationship of this public-private partnership, the structure you described, and the Mayo Clinic and the ownership of the Mayo Clinic, which seems to have been passed to these structures that have been set up.
Yeah, it was very, very purposeful to have what we called sort of an even board, if you will, because most of the money is coming from the state of Minnesota. So obviously they had the most represented on the board, then the city, of course, and then the county. Mayo Clinic's investment is, of course, about 3.5 billion of that $5 to $6 billion that we're going to invest, that we're going to put in the ground. Half of that is Mayo Clinic's. So that's a huge investment on Mayo Clinic's part. The other thing we did, which I think is really smart, is this nonprofit board that we created and company that I lead, the Economic Development Agency. That board is actually appointed by Mayo Clinic. So that keeps Mayo Clinic, you know, they have skin in the game, of course, excuse me, but it also keeps them in the game for the next 20 years, because they actually are the ones that are appointing the board members. Now, not all board members are Mayo Clinic employees, but they actually are the appointee of the board. So again, it's all of these entities working together. They all have their place. They all have their role. It took us a while to figure all of that out. We did a lot of work on the front end, about 1.5 years on the front end, to figure out governance structure once we came out of the state of Minnesota. And we also built our plan. So we built a 700-page development plan that is really serving us quite well right now. We're in our 5-year update right now, and we've surpassed all of our goals so far for that first 5 years. So again, the model is successful and it's working, and I feel like it's something that people should pay attention to.
Yeah, no, it's really fascinating, Lisa. A lot of our viewers and listeners are part of hospitals and health systems from around the country. And as they listen to you, I'm sure a lot of them are asking, well, that's the Mayo Clinic. Mayo Clinic is sort of up there always at the top, or one of the top hospitals around. They can pull something like this off, or maybe Cleveland Clinic could, maybe MD Anderson, but something like this just couldn't be done by our smaller hospital system or in other parts of the country. How would you respond to that?
I respond to it almost every week. Somebody's calling asking, could we do this in our community, and or could we, you know, work with our public-private partnerships? And I say the answer is yes, and it's scale. You know, not everybody has the world famous Mayo Clinic in their backyard. I totally get that. But it's all scale. You have a company in your city that's usually some type of leading anchor institution or company that you can work with. I've been to smaller communities where I've really helped people understand that how do you take what's happening in Rochester, if you live 45 minutes from Rochester, how do you take what's happening in Rochester and apply it in your own community? Sort of that targeted effect or the ripple effect. So what's happening in Rochester is going to affect these smaller communities, and we're seeing it in spades now. Higher housing, more housing coming through, diverse businesses coming through communities. And so people can apply it in so many different ways. I've been to several states across the country talking about how they could do this in their state. And you know this better than anybody. All state regs and policy is a little bit different, and you need to really think about how it could work in your state and how to apply that. Everybody's got a little nuance in their state, but I really do believe it's a model that can work depending on what your anchor institutions, what they are, and how interested they are in participating.
The issues surrounding the types of patients who come to Mayo, although this is not specifically built just to take care of them, how do the entities think about it? From overseas, I assume most of the the international travelers coming for the best in the nation, best in the world care at Mayo are people of resources, or people who have the wherewithal and have the finances to be able to come there. So you have this, not necessarily an elite group, but higher in from the socioeconomic scale. And then you have the obligation of Mayo and every hospital in America to take care of the people less fortunate, more vulnerable, lower socioeconomic status, more Medicaid. Your constituency there is not that of Hospital Corporation of America, is not that of Sutter Health System, and is not that of even Vanderbilt here. But how do you cater to the needs of these various, very different types of populations that Mayo disproportionately does take care of? It's represented by these people in these disproportionate groups. How do you address their varying needs?
It's a pretty interesting dilemma. It's a really great question, because when we were building DMC, we're really building an ecosystem to surround these people. And that means food and restaurants and hotels and entertainment and walkability. We hired groups, I remember hiring Northwestern University to come and spend 6 months with us. Some people from one of their programs spent 6 months with us, and we walked with the patients. We walked to their hotels, we walked to the eating spots, we walked them through their clinic appointments, and we understood where the gaps were. And we did that with multiple sectors of patients, so we could understand what one sector is looking for as opposed to other sectors. And we tried to weave that together as we built this plan. And it's everything, to create that experience that you're talking about for all groups. It's everything from housing, it's hotels. As I said, we needed to build a bioscience life science campus because we need to attract talent to Rochester. So it's not just about the patients, it's about people that live here. It's about people that we want to attract. Mayo's trying to attract the best and the brightest, and it used to be Mayo Clinic would attract the best and the brightest. It still does, but now school systems and community and entertainment and things that people are looking forward to do are big factors in decisions they make where they're going to live, in terms of where they're going to live. So we had to actually reinvent our city, in a sense, sort of transform our entire city, particularly the downtown. One example of that is we'd had very little downtown housing, so we need to create density downtown so that we can support some of those great retail and some of the great restaurants that people are asking for. When we did our surveys, people were asking for certain types of things, and that's what we needed to build. So we had to do everything. It wasn't just a product or one service or being nice to each other. I mean, we do that really well, Senator Frist. I don't know if you've been here, but the community wraps itself around the patients in an amazing way. And an example of that just happened to me the other day. I was helping a patient. I thought she looked lost. And so we're really good at helping patients when they're lost. So I asked her if she needed, directions. And she said, I am so thankful that you stopped me to help. She said, but I just need you to know I'm trying to get to my next place, but everybody keeps stopping me to help me get to my next place. She said, I just need to get there. And so we're so helpful in terms of service that we want to make sure that people recognize that and understand it and build the infrastructure that can really support those patients and those of us who live and work here. So it's really for everyone. It's a little bit of everything for everyone.
Yeah, it really is interesting. As I mentioned, I've referred so many patients over the years there. They almost always, I'll say always, but I'm sure it's just almost always, come back and say that they were treated with so much respect, that their needs were taken care of. And they would very quickly say, it's not just my medical needs from the moment I walked in. And just listening to you, I can tell that this American city sort of built around health. That is the goal, is to make sure that overall city and overall region is equally welcoming to what goes on in the clinic. That's very exciting, because I think all of us know that so much of health and well-being and outcome does depend on the psychological and on the emotional and on acceptance. And it sounds like you're really moving in that direction, which is exciting. You mentioned the Biosciences Center. Do you think in the full implementation of the next 15 years of this plan, there will be an attraction to industry, the bioservice industry, the healthcare service industry, the medical technology industry? Is that built into the plan?
It is. It's a very large part of our plan. As a matter of fact, it is the economic driver for the DMC plan in and of itself. We have what we call Discovery Square, which is about a 16-block area that is really focused just on that. So it works with Mayo Clinic, other companies. We have a developer that just built a building called One Discovery Square. That building is actually fully leased right now, about 2 years early, and we're now breaking ground on the second building. So the goal, of course, is to bring in new businesses that Rochester has never seen and new companies that Minnesota's never seen. And they will live and survive in Rochester. And what we're hoping for is in Rochester, in Mayo, we do a lot of innovation and develop a lot of companies, but they spin off to the coasts right now. And what we're hoping to do is build this center of gravity, if you will, right downtown, so that these companies will thrive in Rochester, Minnesota. They'll stay here, they'll attract jobs, they'll attract other companies, which is what's happening right now. And Google is in Rochester now. They never thought of Rochester before. Just as one example of many now that people are really starting to understand that they can sit right next to Mayo Clinic, and literally in a community of our size, you can walk across the street and have a little lunch with some doc at Mayo Clinic and then go back to your office. And that's what we're hoping to create, these collisions in these buildings where people will just run into each other, create, innovate, build, grow, change, and of course, grow the economy in Rochester. So it's happening. I mean, it's really fun to see this building that we built. We purposefully built the building so it didn't feel like all Mayo Clinic. So Mayo Clinic is only 30% in the building, and all the other companies are 70%, because we wanted to start this new sort of vibe, if you will, in Rochester that's kind of a little funky and a little wonderful and a little disruptive, and of course, based on science and research. So we're all living together on that one.
Yeah, no, and that collaboration that comes out of that bringing together of all sort of seemingly disparate thoughts, ideas, people, brings an energy and excitement to an area, and that's why the ecosystem approach I know is so important. Let me turn to a sort of the current events of the pandemic, and as we're speaking now, we're probably in the 6th inning of this pandemic. We're sort of right in the middle of it. Dr. Genrico Perugia, who is the CEO there, characterized the ongoing pandemic as, and I quote, a stress test for healthcare. Tell me a little bit about how the pandemic has impacted the Destination Medical Center, the plans, the implementation going forward.
Well, we're studying that right now in a really great way. I would say Dr. Frugia, he's a wonderful leader and he's very visionary. And so I loved the point about it being a stress test, because I think the pandemic has actually fast forwarded all of us into the future, faster than we ever thought we'd be there. And we need to think differently and faster and be a bit more creative in how we do everything. On the DMC front, it's affected us. It clearly has, just like everybody else. Retail, restaurants, hotel numbers are down. But what we've learned, we hired a firm called HRNA to do a study for us and a scenario planning for us, so that we would better understand the economic impact of COVID in Rochester and in the surrounding region. And we've learned quite a bit from that study. And of course, there's some crystal balling going on that all of us have to endure. But basically, we've learned that Rochester is in a little bit, we're in a better position right now for a few reasons. Of course, Mayo Clinic is helping us to be in a better economic position, and DMC tools. So we are continuing to build buildings, and we're doing infrastructure improvements right now during this pandemic. That's a good time to get roads and sewers and things like that done when it's a bit quieter in terms of the retail happening right now. And so we feel like we're in a better position, but what we intend to do is to move forward very aggressively on helping small businesses, because small businesses are floundering. And you asked a question earlier about how we meet all the needs of those different constituencies. And in this case, we need retail. We need mom and pop shop retail, and we need, you know, box retail, and we need all the sectors of that, and we need to keep them alive and healthy. So we're doing everything we can to really help our retail and our restaurants. We're doing things about extending the season in Minnesota. Believe it or not, we're hoping people will be really hardy like we usually are and eat outside a little longer. And so we're doing things with you know, heating control and element control and everything we can think of other than building little igloos to make sure people stay outdoors and eat. And that's not far from the truth, actually. And so it's affected us, but we believe that we are in a position of strength. Our first 5 years of DMC, we put in almost $1 billion of investment in the ground. And so we are in a position of strength. And now what we need to do is focus on those businesses. The next few years, we're probably going to have to fill commercial real estate rather than build it. You know, there's going to be some vacancies that are going to be happening over the next few years. And so we're going to probably end up building it or filling it. We're going to continue to focus on infrastructure and some of those public realm. We're building 2 parks right now that are just right downtown that are spectacular. And that's going to continue the draw, both residents and patients. So we've got a lot of work to do the next 5 years. It's going to be gritty, hard work, just like it was the first 5 years. It's just going to be a little bit different.
Another thing that's an acute change that clearly has impacted, I think, mentioning parks, people personally, for me, I love spending time in nature, and I live more in the country, but if I were in a more urban area, to have those parks to go to today, that centeredness that comes from being around nature is something that COVID has clearly impacted my life. And that's the sort of planning and implementation and execution that does make a difference, I think, for people and their well-being. In
Green
2013,
space makes such a huge difference. Oh,
yeah,
sorry. Green
no,
space makes a huge difference. Our research told us that patients, particularly patients, when they come to Rochester, they want green space. They want a place to pray or to sing or to think or to meditate or to walk. And we need to build it downtown. And that's hard to do when you're trying to build this giant ecosystem. And so we don't want to turn into Cementville. We want to make sure that we have a nice mix for the patients and those of us, again, who live there.
and that's where you're focusing on health and well-being. The well-being brings in that emotional and the spiritual and the centeredness and all coming in. Yeah, back in 2012, 2013, when you're doing the initial planning, it was very different than today. And today, there's this great movement towards out of bricks and mortar infrastructure hospitals to where care is delivered more in the community, more at home, the closer to the home, in part because people's comfort level there and affordability and convenience, it's all moving in that direction. How has that changed either your planning or what are you doing to incorporate this closer to home, more community-based care instead of the central bricks and mortar delivery?
Well, Mayo Clinic is doing a lot of work in terms of the actual virtual care and doing care closer to home. And they've got an infrastructure called Mayo Health System that is it's about 78 healthcare clinics in the 3-state area that works with Mayo Clinic on just that. In terms of DMC, we're working more on the hospitality side. So hotels now, we've just built 5 hotels in the last few years downtown because we had a kind of an aging product, if you will, of hotels. And so a lot of those developers now are asking, how can we help Mayo and how can we help a patient? So our research told us that after day 3, when patients are here for up to 3 days, on day 3, they finally have time to look up and out. You know, the first they had to figure out who their doc was and how they found their way around Mayo Clinic and how they got through our subway. You know, we have tunnels underground. It's a pedestrian subway, but they're still waiting for the train sometimes if they didn't realize that it's only a pedestrian subway. So they have to find their way through Rochester. Then they look up on day 3 and they find out perhaps their diagnosis has changed and they're going to have to be there for a month. And then everything changes. Everything shifts and things move so differently for them. All of a sudden, they need a different kind of hotel. and they need a different kind of chair in their hotel to serve them. And so hotels now, to your point, are saying, how can we help with the extended care? So can we get your patients out of the hospital sooner if we can take care of them in the hotel? Housing is doing the same thing. They're starting to do some short-term leases that they never had done before to help the patients just get out of the hospital. Sometimes they need to be closer to Mayo Clinic, so they can't go all the way home yet, but it's sort of that in-between place that isn't a hospital. So we're working with both those sectors, hotels as well as housing, to see if there are places for us to step in and really help the patient.
You know, you previously served as division chair for the Mayo Clinic Public Affairs, which focused on advancing Mayo Clinic's commitment to be a socially responsible enterprise. Can you share with me a story or two about how Mayo has acted on that commitment?
Yeah, Mayo is very generous in the community, and they give and they give and they give, and it's important. You know, they're a huge part of Rochester. So two things come to mind. One is Mayo just housing is such a big deal, and affordable housing is critical for Rochester. It's just critical for us. And so Mayo has become part of a collaboration now where it's Mayo Clinic, the county, the city, and our area foundation. We have a foundation in Rochester as well. Mayo Clinic put in the first $4 million. And what they're doing now is to try to figure out how we can provide more affordable housing in Rochester for whether it be Mayo employees or just people that live in Rochester. And so it's a perfect example of Mayo giving back to the community. One other example, Mayo's worked with the state of Minnesota on mental health being it's a big crisis right now. And Mayo worked with the collaboration again to bring in $5 million. We just built a mental health crisis center, a 24/7 crisis center in Rochester for adults and for kids. And it's another example of Mayo recognizing the issue, recognizing a social issue that's happening and how it intersects with healthcare and stepping in. So they're giving back in great ways like that. And it really means a lot to this community.
You know, we only have a few more minutes, and as I listen to you and the broad experience you've had and the wonderful trajectory of career and careers and positions that you've had, let me close on something just a little more personal. As you look back over your even young years or your career or your working years, was there ever a pivotal moment? We all have many pivotal moments, but can you give us a pivotal moment that has either changed you, changed the way you've thought, changed the direction of your career, that you'd be willing to share with us?
Yes, I have many. Like I probably have a pivotal moment every day. I think I learned something new from someone. I know I do every single day, and I've stepped in many potholes. But here's a really interesting one for me. It actually relates to DMC. I learned in kind of a hard way, actually. It was kind of a tough lesson that a little less than perfect can create greater support. So what I mean by that is we worked our tails off to bring this economic development plan to the state of Minnesota. It was a perfect plan, Senator Frist. It was just right. And I learned so quickly that it shouldn't be perfect. It had to be messed with. Like people have to mess around with something to own it. And so, and I could learn it over and over and over again, the same thing, meaning get a lot of support, let people build it with you because you'll get greater support. Even if it's just not as perfect as you thought it was. This thing came through and the DMC legislation was passed. It wasn't exactly the way we brought it forward. And I actually think it was probably better the way we brought it forward, but in the long run, it was much better and more successful because people got to make it their own. They got to build it with you. And so that was a lesson I would share with so many people in terms of how you get advocacy and support behind you and with you so that something can be successful.
No, I think that's wonderful. And I think it's a great lesson a great example, and it applies to leadership generally, that people commit, they make decisions, and you need to make those decisions, and you can't wait till things are perfect, because they're never going to be perfect, and sometimes
Right.
being a little bit less than perfect can be your greatest strength.
That's right. That's right.
Thank you so much for being with us today. The Destination Medical Center Economic Development Agency is such a terrific model. First of all, it's going to do great things there, and for patients from all over the world and patients in the region there, the idea of establishing an ecosystem that looks holistically at individuals, their medical and non-medical needs, is something that we all strive to. But I can't think of any better example in this country or in the world than what you're accomplishing there at the Destination Medical Center. So thank you so much on behalf of all of our listeners and our viewers today. I look forward to talking to you again. Appreciate it.
Thank you very much. Appreciate it. Enjoyed it.